For people with prominent ears, they're really bothered by them, even though their loved ones may give them reassurance like, hey, it's not that bad or it's not that big a deal. If it bothers you enough, come see me. I'd be happy to evaluate you and see if we can help you. And by and large, the people with prominent ears for whom I correct them, they're just delighted with the results. You know, it changes how they feel about themselves. They look at their face every day in the mirror. Everybody looks them in the face. And if you can feel better about it, then all the more power to you. Hi, I'm Dr. Navin Singh from Washingtonian Plastic Surgery. We'll talk about otoplasty for the next few minutes. As I look at you in the office, I'm analyzing all of these landmarks on the ear. Why? Well, if we don't analyze it properly, we can't give you the proper result. So I'm looking at all of these ratios, proportions, landmarks, and their relationships to identify wherein the problem is so we can correct it. It may be in the conchal bowl, it may be in the antihelical fold, but we'll find it together and we'll create an appropriate correction for that. We'll take some measurements to see whether the length and width are appropriate, whether it's projection off the mastoid, meaning where the ear meets the skull, is appropriate or over-projected, and where the issue is. So this is a little bit of the nuts and bolts. This diagram depicts creating an antihelical fold. You don't need to know about all of this stuff, but I do. In children who have a flattened ear fold, we can correct it by creating a fold and tacking it down to the mastoid, or meaning the back of the skull, with sutures, as well as resecting any extra cartilage that's causing the projection. The incisions are all behind the ear, so they're pretty covert. You know, they're hard to see, they're hard to find, and as I joke with my patients, you're not going to see them unless you get CSI in there doing a full-scale investigation of your ears. This young man came in for correction of something he'd been teased about ever since he was 7 years old. He was tired of it. It's time to do something about it. Hour and a half later, both ears are corrected. Loves the results. This schoolgirl was brought in by her mom and dad. She was getting teased. She was getting into those awkward teen years. She needed one less thing to be worried about. And we did an otoplasty, got her the results that she wants. And now she's happy to wear her hair up or down as she sees fit and comfortable around her peers. This depicts a front view and a back view of prominent ears, again corrected in about 2 hours. He had it done on a Thursday, was back to work on Monday. This person traveled all the way from the West Coast to come see me. We set up a Skype consultation initially. We talked about what his goals were. He sent me some photographs. I reviewed them and I thought that I could responsibly and predictably get him that result. He came, flew down to the DC area, stayed here for a week, delighted with his outcome. Sometimes it's just 1 year. More often than not, it's both, but sometimes it's just one, and we can correct whether it's one side or both sides. So the ear is never seen at the same time as the other ear in full view. So if you're looking at somebody, they're either going to turn this way or that way. And there's a second gap in between when a person sees your left and your right ear. So small asymmetries, not a big deal. The mind just glosses over that. Nobody else will notice. You may notice, but others will not. The other thing is that when you're looking at the ear front on, you're really only seeing the silhouette or the edge of it. So some asymmetries are very well tolerated, and nonetheless, we're committed to trying to get them as symmetric as is humanly possible. So I do tell my patients that the cartilage in the ear is a little bit like a slinky. It does tend to have some recoil. It wants to come back. So we may over-tighten a little bit to allow healing in some areas and under-tighten in other areas to allow scar tissue to form, because that will contract some of those areas. The first day you'll have some bandages on. After that, I say wear a headband, mostly just at night, so that when you roll over in your sleep, you don't hurt the sutures. But we don't need you in a compressive head wrap for a long time. It's just really to protect it, and a Nike headband is plenty fine. She's 23 years old. She's been bothered by her ears ever since she was about 10 years old. She never told her mom, and her mom just felt terrible. She said, you know, if you told me, I'd have taken you to the doctors. Well, she finally got up the courage, came, saw us, and we got her the result that she'd been wanting for the last 10 years. So as you can see, the incisions are quite hidden. They're right in that groove between the ear and the skull. They're not going to be visible. Over time, they'll fade away, and you'll forget that you ever had those. I invite you to come to our website at www.washingtonianplasticsurgery.com, look at the gallery of before and afters, and know that when you come see us, we can create solutions for you. Thank you very much.